first by going to the medical record, and I would see what we'll be doing. Today we're going to be dealing with a male catheter, and his name is Mr. Jones, so that's what we're going to be doing. And I would gather my designated supplies, and in the video we're supposed to be wearing these, but I wouldn't be able to talk clearly, so I'm going to take it off for this case. I would gather my supplies like I said. I would do hand hygiene, and I'd wear PPE as indicated by the facility, and then I would go to the patient's room, knock on the door, wait for invitation. Hi, Mr. Jones. Today we're going to be doing inserting your catheter just to relieve some urine tension on your bladder, okay? And with doing so, we would check for any loss of mobility to see how much help they actually need and how much they can actually assist us. And then I would get my gloves. Oops, I gotta grab that one because it dropped. I would provide good lighting, and in a real situation, I would ask for a nurse assistant to come in here with a pen light so that she can hold it while we're inserting the catheter. But in this case, the lighting is good enough. I would lower the head of the bed, raise the height of the bed, but this height is okay for me. And then I would lower the side rail on the side of the bed that I am on. I'm going to place a back blanket over them. And I would remove the bed blanket from beneath and the sheet, only exposing the area needed, so like above the perineal line and then about the knees levels. And he's got loss of mobility, so I'm going to help him with the dorsal recumbrant. Do you have any allergic reactions to latex or iodine? He's allergic to iodine, so when it comes to the procedure, we're not going to use no iodine. I would place a disposable chuck from under Mr. Jones. He's already got one. And then we're going to start with perineal care, and I'm going to use wipes, or you could use washcloth for the sake of time, but also the use of supplies. I'm going to do one mitt. I'm going to use one wipe, but in a real situation, you would want to use a different wipe per swipe. But in this case, I'm only going to use one. So you would start with the penis, circular motion, pull the skin back, and you would replace the skin as you had it, and then you would go down on the shaft, and then down on the pubic. And like I said, the pubic hair. But on the sides, we would have did the penis, throw it away, and then I would get a new one. Then I would do one side of the shaft and one side of the pubic, throw away. Then you would do the other side of the shaft and do the other side, and then throw away. Then I'm gonna throw my gloves away. And since we have a moment where we're not going to be touching them and I'm going to set up my sterile field, I'm going to provide them privacy just by covering them. And now I'm going to set up my sterile field, so I'm going to wash my hands. I would wash my table off. I'm going to place these over here, and plus my sling because we don't need them. So I'm going to wash my hands again since I had to touch that stuff. I grab a sterile rag and I clean my table off. And I'm going to set up my sterile field. And I have my supplies on the overbed table. I'm going to set them up. And I also have my trash can in reach, so I'm going to throw it away. And with opening up my sterile box, you don't want to reach over, so I'm going to open. And I'm going to pull it to the side a little bit so that I could do my sterile gloves over here. Only touching the outside. Oh, also, I would have provided privacy by closing all curtains, drapes, and doors. Only touching the cup that's folded. I'd touch that to get my gloves on. And I do my non-dominant hand first. And with the gloved hand, I'd grab the other gloves, only touching the cup as well, pushing my dominant hand in. And once I get my second glove in, I'm going to check for any tears, holes, and proper fitting. They fit good. And now I'm going to properly unfold the cuffs as we can. Now that we have gloves on, I'm going to pinch this, and at waist height, just drop into the trash can, because now my hands are sterile, so I don't want to lower them. And then I'm going to place, I did it again, I would have uncovered him before putting on my sterile gloves. So in this case, I would remove them, hand hygiene, uncover him, hand hygiene again, and then I'd go and get some new sterile gloves. But for time, I'm just going to do it. So now I'm going to create a sterile field over here so that I can place my box on top.
Maybe? Yeah, it's for this case I just did it. Yep. Because I'm not handed, but we have some. Oh, yeah.
And then I'm gonna, for a man, we do use this, you just place it around. Okay, and I'm gonna place my sterile box over here. So like I said, iodine, Mr. Jones is allergic to the iodine, so I'm just gonna throw away, but we're gonna just put everything here because I have to reuse it. So I place everything accordingly. I'd fluff my cotton balls with my tongs. I'd place my chloride in it, throw it away because it's empty. I'd open up my lubricant, throw it away, and then I'm going to take off my cap, off my syringe, and for a catheter, usually the tube has a sheath on it, but mine's already off, but you would just remove it and throw it away. And I'm gonna connect my syringe to my catheter. Now that it's connected, I'm gonna place the tip 1 to 2 inches in the lubricant just to have it starting to be lubed up. Now when I use my non-down hand, this minute I touch the penis, I can no longer take my hand off the penis. It is now non-sterile, so I can only use this hand as my sterile hand. So I grab the penis, circular motion, throw away. Now I'd pull the skin back, and then I would down the shaft, throw away, down the shaft. Then you just want to do this 2 to 3 more times just to make sure it's clean. And if you would like, you could do the testicles that is shown. Throw away. I'm just gonna throw this away as well since we're done with it. And then make sure it's real lubed, 1 to 2 inches like I said. And Mr. Jones, I'm gonna be inserting your catheter, so I'm gonna pull the skin back. And then as I'm doing this, I want you to bear down as if you're going to the bathroom. 1, 2, 3. And as inserting it, I would go up to the Y, or until urine comes out. Urine's coming out, so I know that I'm in the proper placement. And then my syringe came off. So if you could do it one hand, but if you couldn't, you would have to redo your sterile gloves. But as you're inserting the water, do not let go up here because it could shoot out and then it could hurt the patient potentially. Okay, I'm gonna let go of this so I can connect it properly because it just keeps popping off. See, it just keeps popping off. Well, I don't have another catheter, so in this case, what I would do is I would have put my new sterile gloves on, I would hold it here, and I would inflate the syringe, all of the water into the catheter. And once this is empty, I would throw it away, and then I would hold the penis and slightly tug on this, and if it's in proper placement, I could, the balloon would stay, the catheter would stay in. So I'm just gonna pull it, and it's staying in, so that means it's okay. And then now I'm going to take this, and I'm gonna tear the sides. I'm gonna take his bag, and I'm gonna hang it on the side rails, on the hooks of this side of it. Okay, it's hooked. And now I'm going to remove all of my supplies. I'm just going to place it here because I don't want to throw it away, but you would throw it away. And then I would remove my gloves, do hand hygiene, put on new gloves, and if needed, I would wipe away any extra lubricant and do any extra perineal care. And now I'm going to strap the catheter to his leg with the sling. And with strapping the sling, I want to make sure that he can still have leg movement. So strap above the Y so that if you just needed to do anything with it, you could. Like I said, don't do it too tight. Just make sure there's some slack, which he has plenty. And then I would lower his legs, and I would lower his legs, cover him back up, and I would remove his bath towel, and I'm going to place it in my laundry basket. And then I would raise the side rail, lower the bed, and I would raise his head in bed, make sure he's in a comfortable position, and place his call light in reach, his bedside in reach, and I remove all my supplies. Like I said, I do hand hygiene. And if needed, I would put new gloves on, and I'd get my specimen container, and I would do my catch from the new bag, and then I'd take it to lab, and I would label it accordingly, and then I remove my gloves, do hand hygiene, and that's it. But now we're gonna do removal. So when walking into the room, you wouldn't see this, but I would go to my medical record and I would see that Mr. Jones is getting his catheter removed today. I would gather my supplies needed, and then I would do hand hygiene, and I would put on my gloves and PPE as indicated per facility. Hi, Mr. Jones. My name's Sarah. We're going to be removing your catheter today. So I have my gloves on, and I would clean the table always. And then I would lower the side rail, raise the head of the bed, lower the head of the bed, raise the level, lower the head of the bed. Means that proper level for me. I would place the proper equipment out that I need. So like I said, in this case, this stuff wouldn't have been here. Just this, a clean chuck, but I'm just gonna reuse it so I don't waste supplies here. And then I would have my syringe. And then I would lower his thing. Before doing this, I would have closed the curtains, but the curtains are already closed. So I'd lower his curtains, I'd place a disposable check beneath him, and I'd place my trash can right here. And then I'm gonna place an extra one, just so when I remove his catheter, I can place everything on this, and also just extra protection. And then I would get my urinal. I'm going to remove all of the urine, 980, and I would check it for color, odor, kerosene amount. It's normal. So I'm going to bring it up here since we're moving it. I'm going to place it on that pad. I'm going to remove his leg sling. Just going to place it over here. And then I'm going to get my syringe, take the cap off. And I would, with deflating it, you need to know that when you deflate it, we only let the syringe deflate it. We do not pull on it and then suck it out ourselves. We just let gravity do the job. So I would hold the catheter so it doesn't just push out, and then I would connect it to this green part of the Y and hold it, and then when it's done, it'll be all the way out. Mr. Jones, we're going to remove your catheter, so if you can, hold your breath and bear down. And as he's bearing down, I'd say 1, 2, 3. And when you remove it, you just want to do it quickly and straight out. So 1, 2, 3. And if there was any retention or straining, I would check to see if maybe there was more solution and the balloon, make sure it was deflated. So now I'm gonna remove my gloves, and I'm just gonna place them on that pad. I do hand hygiene, put new gloves on, and I would do perineal care as needed. And then I'd remove my gloves and wash hands, put on new gloves, and I would remove all of this. And I'd throw it away per facility policy, but I'm just gonna throw it here because I have to renew it. Place that there. I'd remove the disposable check, and then I'm gonna cover my patient. Place their legs in a comfortable position again. If they weren't able to spread their legs themselves. And then I'd raise the rail, lower the level of the bed, raise the head of the bed. I'd place call light in reach, make sure he's comfortable. I'd remove all my supplies, do my hand hygiene, and make sure that the bed table's in reach, make sure that there's no safety concerns. You want your curtains open or closed? He wants them closed, so I'd leave them closed, and I'd report any abnormalities and plus color, odor, characteristics in the mouth to my nurse. That's it.